We still have with us Joanna Williams and Tracy Horn from the Keno Border Initiative. Joanna is joining us from her office in Tucson, Arizona. Tracy is with a young woman named Carmen at the Comedor in Nogales, Sonora, on the Mexican side of the U.S.-Mexico border. I'd like to turn it back over to Joanna, who has been so patient in offering some context for what's happening there on the border. So I'm going to ask her just to briefly, again, provide that context, and then I know she wants to turn it over to Tracy and to Carmen there at the Comedor. Welcome back, Joanna.
Be immediately sent back into the hands of kidnappers. This is something that's going to put women and children in unique situations of vulnerability, especially to trafficking, and ultimately going to increase suffering and death at the border without necessarily any public health benefit. We as the Keno Border Initiative absolutely understand the importance of social distancing and limiting non-essential travel across the border. This isn't the time for tourism or visits or casual cross-border interaction, but it is still a time to respect our laws and values. And we believe that people who are facing immediate danger do count as essential travel across the border, and we need to maintain policies that promote dignity and safety and employ public health best practices. The UN High Commission on Refugees, Doctors Without Borders, Physicians for Human Rights, and many other organizations with medical expertise and expertise in working with migrants have provided a number of other alternatives to this announced policy. Most of all, if we were to allow asylum seekers to enter into a legal process, but then self-quarantine in their sponsors' homes, that would give them the opportunity to really practice social distancing while not sending people back to situations of danger. So we at the KBI join with the Jesuit Network in believing that in this difficult moment, solidarity is really the best protocol. And this is particularly important to us because we, day in and day out, are in contact with the folks who are going to be affected by this policy. So I want to, I know we had some delays for the technical difficulties, so I don't want to take up any more time. I'd rather pass this over to Tracy and Carmen so they can speak from a firsthand perspective about the impacts they're seeing there.
Good morning. Can you hear us okay? Yeah, great. So I'm Tracy and I'm here with Carmen. We're here at the Comedor. I want to see if I can just give you, if you can see behind us, there are folks waiting in line at the Comedor. They're taking food to go. And we're here right outside our Migrant Aid Center. We have sort of our makeshift first aid station set up. So just to give you a little context about where we are this morning, I want to just invite Carmen to introduce herself and tell us a little bit about her story and answer some questions. Entonces, si quieres primero presentarte y explicar un poco sobre de dónde eres, cuánto tiempo tienen aquí, en dónde se están quedando. Cosas así.
Buenos días, mi nombre es María del Carmen. Yo tengo 3 meses aquí, que llegué pidiendo asilo y pues yo estoy temo pues porque se atrasa mucho pues la lista. Yo tiene 3 meses que estoy aquí y ha avanzado muy poco. Siento que, por ejemplo, si ahorita se tiene todo esto que por el virus o por más problemas que se están viniendo, yo voy a tardar pues mucho más tiempo aquí.
So Carmen was sharing that her name is María del Carmen and she's been here for about 3 months, and that yes, she does have fear, particularly that with the virus, first of all, that the numbers have not been advancing, and that even with the virus, that means that they're not going to be advancing even more. And so that makes her concerned.
Sí, yo tengo 3 niños, y mis niños pues aquí pues se me han enfermado. Yo me siento pues a veces que triste porque ellos se me enferman y hay veces que no tenemos el sustento, sustento para poderles dar lo que ellos necesitan, que cuando se enferman pues ellos sufren mucho y nosotros pues por igual porque no tenemos los sustentos suficientes para poder sacarlos adelante.
She said that she has 3 kids and they're here together, and all 3 of them have gotten sick, and that at times she feels sad about that because they don't have what they need here in Nogales to give them what they need, and the same for the parents, that also they struggle to have what they need to sustain themselves.
Pues yo, pues no sé, yo quisiera pues que en esta situación nos ayudara mucho en esto, pues que el gobierno pues de allá y lo de aquí nos ayudaran a facilitar y pasar más pronto la gente que está aquí, que pues sufrimos mucho, estamos en circunstancias que son muy tristes, la verdad son muy tristes porque vemos muchas personas con muchas familias, con familia que somos bastantes pues, niños, señores, que no estamos pues, estamos expuestos a que suframos pues más cosas pues.
So she said that she really wishes that the governments on both sides, in Mexico and in the U.S., would work together so that they could pass quickly to process the people that are waiting. Because so the circumstances here are sad, that there are a lot of us waiting, lots of big families, and we're all exposed to these challenges and risks. No sé si quieres compartir un poco como qué sería el impacto de quedarse aún más tiempo esperando. So I asked if she'd be willing to share, what would be the additional impact for them to have to stay even longer indefinitely.
Sí, pues a mis hijos, pues yo creo que en este tiempo pues nosotros estamos, mis hijos pierden pues su tiempo de lo de la educación, que están perdiendo sus clases, que están sufriendo mucho, que como le comento con las enfermedades que ellos han estado, si no se me enferma uno, se me enferma el otro y así pues los llevo constantemente y pues vaya que son 3 niños y pues no es mucho y pues nosotros nos cuesta pues también conseguir el sustento para ellos, para sacarlos adelante.
So she said, on the one hand, her kids are missing their education, they're missing out on classes, and as she mentioned previously, the illnesses, she said within the 3 of them, if it's not one that's sick, it's another, and so it's like constantly one of the kids is sick, and so it's a lot, and it really gets overwhelming. Si puedes compartir un poco sobre si ustedes pudieran cruzar, digo, como mañana, ¿qué harían o para dónde fueran? So I asked if they were able to cross, for example, like tomorrow, where is it that they would go?
De hecho, nosotros al cruzar a Estados Unidos, nosotros nos iríamos con los familiares y pues ahí estaríamos, de cruzar, llegaríamos para allá y pues ahí estaríamos, a de cuenta como aislados, pues porque ya ve la enfermedad y todo lo que está sucediendo no nos permitiría y pues no estaría correcto andar por las calles y sería pues una cuestión de estar aislados, estar tomando pues, las precauciones las debidas, las correspondientes.
So she said if they were able to cross, she has family members on the other side that they would be staying with, and that of course, as the protocols have told us, that they would be isolated, that it wouldn't be prudent to be going out, but that they would be taking precautions. So I just wanted to add a couple of other notes. So one thing that we've been talking about here, just among the migrants that are here and the staff, that there's this talk of closing the border, and they're already making announcements about that. But it seems very contradictory. Walked over about half an hour ago. There were 15 people who were just deported, and we're standing in front of the Comodoro waiting to be
And we have been live with Tracy Horn, who's with Carmen, who's at the Kino Border Initiative's Comodoro on the U.S.-Mexico border in Nogales, Sonora. And we're having some technical difficulties. So I think we'll turn it back over to Joanna Williams who is Director of Education and Advocacy at the Keynote Border Initiative and has joined us from her office in Tucson. Joanna, maybe you can pick up from where Tracy left off.
Yeah, just to finish some of Tracy's sentences, because it's consistent with some of with what we've been seeing and discussing. As Tracy was saying, really this initiative is closing the border only in one direction. So we're seeing still a significant number of people deported from the United States to Mexico, including many this morning who arrived to our comedor, as Tracy was saying. And it's deeply ironic because these are individuals who, because they've been in the United States, are more likely to have been exposed to COVID-19 than people on the Mexican side of the border. So we're troubled by this policy that's, again, not a response of dignity or safety, and is instead taking advantage of the situation to put vulnerable individuals into risk. And so once again, we just want to remind the public and folks who are watching that it doesn't have to be this way, that it's possible to have other policies. It's possible, as Carmen mentioned, that she would be more than happy to follow health best practices and self-quarantine if she were able to join her family in the United States that's ready to receive her and start the asylum process there. That she absolutely respects the realities of this situation. And so that's the invitation that we have for the governments to really think about this from a public health perspective and not from a perspective that further marginalizes individuals, because indeed solidarity is the best protocol.
Great. And again, we're with Joanna Williams.
Joanna, I'm not sure, we're on the phone, I'm not sure if you all can hear.
Again, we're with Joanna Williams and Tracy Horn from the Keynote Border Initiative, and we had lost Tracy for a second, but she's back with us via telephone. Tracy, did you want to finish those points, those thoughts that you and Carmen were sharing there from the Comedor in Nogales, Sonora, on the Mexican side of the border?
Yeah, so I didn't hear what Joanna shared afterwards, but I was toward the end, I was saying that some of the changes, so we still have people that have court dates in Juarez, in El Paso, so they have to travel to Juarez to be able to report for those courts. Those courts haven't been canceled as far as we know, but because of the changes and issues with the virus, a lot of the buses originally that were going from Nogales to Juarez are being canceled. So the 5 a day that they had previously is down to 1 a day. And so people are still expected to show up for those court hearings, and yet, they're struggling to find a way to get there. So just to give another example of sort of this forced chaos that's happening, that's impacting people, and now knowing that they're going to have to wait longer. And so there's a lot of questions, and I want to appreciate again, Carmen, your willingness to share with us. Quiero agradecerte otra vez, Carmen, por su disponibilidad, por
gracias a ustedes que escuchan nuestras historias y las comparten. Gracias a ustedes por las ayudas que nos dan también. Y pues me despido de ustedes.
So she said, Carmen said, thank you so much for all of your support, and for listening to our stories as well, and for all the ways that you help with what's going on with us.
And please thank Carmen for us on behalf of the Ignatian Solidarity Network and the Ignatian family across the United States. That there are many people who are standing in solidarity with her and many others in situations like her and her family, and we'll keep them in our prayers. So again, that was Carmen and Tracy Horn, who are joining us from the Comedor at the Keynote Border Initiative on the Mexican side of the border. Now, Joanna, and maybe Tracy too, if you're still able to join us, stay with us. In your statement that you issued the other day in response to the administration's policy change there at the border, you said we must continue to act with decency at this time and expand on our obligation to respect human rights and due process. It seems that what you're saying is that we need to sustain our commitment to human rights. We need to sustain our commitment to responding to the needs of asylum seekers who are seeking refuge from danger, from violence in their home countries, regardless of the public health situation. That our responsibility to be concerned about others doesn't go away in the midst of the challenges that our country faces. Does that sound right?
Yeah, this is precisely our perspective as the Kino Border Initiative, and again, one that's been echoed by public health and immigration experts around the world, that this isn't a situation of a trade-off. It's not either we protect public health or we protect our legal rights to asylum seekers. There's really a situation of a both and, that we're able to effectively protect asylum seekers, effectively uphold our legal obligations, and do so in a way that promotes the best interest of public health and safety. And so any effort to make that seem like an alternative or a trade-off is misconstruing the situation. We believe that as the Kino Border Initiative, that there are plenty of important practices we can implement: screenings as individuals arrive, appropriate medical care, and as we've mentioned, folks are in a situation to better promote public health if they're able to be in their sponsors' homes and self-quarantine in that context, instead of in a limbo of transition. And so it's now more than ever is the moment to make this call. Now more than ever is a moment to realize that how we treat our marginalized communities, whether those are communities in the US or in other countries, is going to reflect on how well we're able to control the pandemic. Further marginalizing already individuals who are at the edges is only going to make it more difficult to address the realities of COVID-19.
And Joanna, Kino Border Initiative closed the statement on this policy change there at the border, saying the administration has been continually focused on ways to stoke fear of migrants, eliminate access to long-held protections, and dramatically reduce due process. Can you talk a little bit about kind of this policy change in the midst of kind of a broader reality there at the border, particularly what both migrants and asylum seekers are facing?
Sure. So I think, and I think this is also part of what I was maybe cut off during the technical difficulties. So this is for those who weren't able to hear in the beginning, speaking a little bit to the fact that this is just building on a tradition of the administration's policy to eliminate access to asylum. So this is not relevant to coronavirus specifically. This is simply a plan that they've had on their desk that they've been waiting for the right moment to publish. And we can say that with some degree of confidence because we've seen the other ways that the administration has tried to limit access to asylum. That includes the Remain in Mexico policy, under which individuals are returned to Mexico to wait for their court dates in the United States. It includes accelerated deportations of asylum seekers under policies called PACER and HARP. It includes the announcement that anybody who's transited through another country, such as Guatemalans or Hondurans that go through Mexico, are automatically ineligible for asylum. So this is a long tradition of a couple of years of this administration trying to find every opportunity to eliminate access to legal protections and turn our backs on individuals who are fleeing violence and seeking safety in the United States. And this new announcement has much more to do with that long tradition of anti-asylum policies than it has to do with the current situation of the coronavirus.
Thanks, Joanna. And again, we've been joined today by Joanna Williams and Tracy Horn from the Kino Border Initiative, offering perspective on the policy changes there at the border related to the public health crisis that are further marginalizing immigrant people there. Joanna, could you tell us just a little bit about what you think are some action steps? In a moment, I'll share information about an action alert that's been issued by the Ignatian Solidarity Network, but maybe would you like to talk about some things that people can be advocating for to their members of Congress, to the administration in the coming days and weeks?
So this is a particularly important moment from the safety of your socially distant homes, in which you can engage with members of Congress. They're making critical decisions about how to address the public health situation And in the midst of that, some of these anti-immigrant and anti-asylum policies are being slipped in. So we really would like our networks to first of all call on your members of Congress to make public statements opposing this elimination of asylum at the border. We need members of Congress to be very clear that this is not in the interests of the United States, not in the interest of containing the coronavirus, but is simply an anti-asylum policy. Second, call on your members of Congress to not approve additional funding for ICE, Immigration and Customs Enforcement, or CBP, Customs and Border Protection, in these different supplemental appropriations bills. We need more money for hospitals. We need more money for protective equipment. There's a lot of this response that needs more funding. Immigration detention is not where we need to be putting our funds at this time. So call on your members of Congress to not expand funding for immigration detention. And again, we want to call on Congress to push the administration to eliminate, or to reduce the populations within immigration detention in order to better protect individuals in that situation so that they can self-quarantine in their sponsors' homes. And in particular, that's an action you can take with members of Congress. But you can also call on your state governors and state leadership to issue public health guidance that would then require Immigration and Customs Enforcement to implement those practices at detention centers by releasing some individuals to their sponsor families. So that's an action you can do at a federal level, but it's also an action that you can do with your state officials.
Great, thank you, Joanna. And again, we've been joined by Joanna Williams and Tracy Horn from the Kino Border Initiative to talk about the changes in administrative policy at the U.S.-Mexico border in light of the public health crisis. If you visit ignationsolidarity.net and scroll down to our Action Center, you'll find an action alert that can make it very easy for you to contact your members of Congress and share those exact points that Joanna just offered up to us as ways of advocating, of standing in solidarity, of calling for safety and health at the border, just like we're seeking safety and health within our own communities. And so really appreciate, Joanna, your time with us today. Thank you so much for being with us. Thank you for your continued work that you and Tracy and your many colleagues, both on the Mexican and U.S. side of the border, do to support and stand in solidarity and accompany those who are migrating. And good luck and thanks for your time today.